Hello everybody, my name is Micah Boyer and today I'm going to talk about the health and performance benefits of vitamin D3 supplementation. And so first off, vitamin D3 is identified as an essential vitamin and acts as a precursor steroid for biological processes throughout our body. Found in very few foods including fatty fish such as tuna and salmon, and small portions can also be found in other things such as cheese, milk, egg yolks, and other dairy. It can be produced when we are exposed to sunlight from endogenous production and is involved in over 300 biochemical reactions in the body, and it helps to promote calcium absorption and gut health. Vitamin D3 is important for biological processes in our digestive system and a foundation for bone tissue health. It acts directly on our muscles for protein synthesis, and nearly all people are somewhat deficient in vitamin D3. The first article I picked was called Athletic Performance and Vitamin D. And so the first chart in the top right is women and men age 45, and it's their average vitamin D levels throughout a 12-month period. And the men are in the dark and the women are in the lighter color. And so it shows that when you enter the fall and winter months that our vitamin D3 levels decrease. And then as it starts becoming spring and summer again, that they increase because the UV light exposure comes back. And so cutaneous vitamin D production can be absent or drastically reduced during winter months. Total mortality was 26% higher in those with the lowest calcifidiol levels compared to those with the highest. With levels below 40 to 50 nanograms per milliliter, the body diverted most or all of the ingested or sun-derived vitamin D to immediate metabolic needs, signifying chronic substrate starvation. And so muscle biopsies were performed on 11 older patients with osteoporosis before and after administration of vitamin D, analog together with 1,000 milligrams of calcium for 3 to 6 months, showed significant increases in both the percentage and area of top 2 fibers despite the lack of physical training. And so they took muscle biopsies of 11 older patients and they supplemented them with vitamin D for 36 months, but they didn't have them do any kind of exercise or training program, but it still showed that it increased the amount of top 2 muscle fibers that they had. And so this bottom figure right here is from an experiment where he gave 30 children in the control classrooms 250,000 IUs of vitamin D as a single dose in February, and found that their cardiovascular performance improved dramatically, approaching the irradiated group 1 month later. And so the darker shade is the children that he supplemented, and the lighter shade is the children he did not. And it starts in December and January, where they would be lowest in vitamin D3 anyways, and then it goes on until March of the next year. But it shows that vitamin D3 supplementation did increase performance on their bike tests that they were doing for the children that were supplemented compared to the children that were not supplemented. And it showed that a 56% greater fitness in the irradiated compared with the non-irradiated control of children in early spring. This is from the same article. This is Article 2, Plausible Ergonomic Effects of Vitamin D on Athletic Performance and Recovery. And one of the first things that it talks about is how 88.1% of the world's population has inadequate vitamin D levels. And some of the health problems that can result from this include suicidal thoughts, depression, cognitive decline, and neurological impairment, and a higher risk of cancer. Vitamin D is essential for adequate bone tissue formation and upkeep, so a deficiency could also increase someone's chances for bone disorders such as spondyloarthritis, rickets, and fractures due to bone reabsorption from an overproduction of parathyroid hormone, which is responsible for calcium levels in the blood. And so this is from the same article. These two figures over here show the food sources and the amount of vitamin D that you can get from them. And the 3 highest levels are salmon, cod liver, and sun-dried mushrooms. And so it says that humans acquire vitamin D from 2 different sources, endogenous after sun exposure or via the diet. Vitamin D derived from the diet and supplementation comes in two forms: the plant-based vitamin D2, ergocalciferol, and the more bioavailable mammal and fish source vitamin D3, cholecalciferol. Once the skin is exposed to the sun's ultraviolet B radiation, it then converts stored 7-dehydrocholesterol into circulating vitamin D3. And the bottom chart is a list of environmental or genetic factors that affect how much vitamin D someone can get from sun exposure. And so some of the things are like how far away from the equator you are, the color of your skin, or age. And it says maintaining a healthy level between 75 to 100 nanomoles per liter could increase aerobic capacity, muscle growth, force and power reduction, and a decreased recovery time for exercise. Article 3 was an experiment with 67 Caucasian professional male soccer players, members of 2 Greek Super League teams and 1 Football League team. And so this was actually at the end of their season that they did this experiment, and they tested them for the 6 weeks, supplemented and tested them for the 6 weeks after. And during supplementation, the first 2 weeks they were asked not to train in any kind of way, and then the following 4 weeks they were allowed to train very minor aerobic type of workouts. So this doesn't actually show improvements in the things that they measured because of that, but they measured vitamin D levels, squat jump, counter movement jump, VO2 max in milliliters per kilogram per minute, and 10 meter and 20 meter sprint times. And so without the training along with the vitamin D, it didn't really show any increases, but it just showed the importance of having a healthy vitamin D level in the blood for performance and recovery. And then it says, analysis of our data showed that although vitamin D increased at the end of the off-season period, all measured exercise performance parameters decreased. However, the observed linear correlation at baseline between vitamin D levels and performance was retained at the end of the study, suggesting that vitamin D is related to the ability to perform efficiently during exercise. And so the chart over to the right is all the measurements pre and post supplementation, and it shows that the vitamin D in their blood levels did increase, but that everything else decreased with this. And that has to do with the fact that they weren't training and that most of them were on holiday outside of their sport. And then in conclusion, vitamin D has been shown to positively impact one's quality of life in a lot of different ways, and it is essential for regulating calcium homeostasis and bone health. Nearly all people are insufficient vitamin D levels, resulting in health problems, and supplementation of vitamin D3 through either food sources or sunlight exposure has shown positive increases of vitamin D3 levels. Increased levels of vitamin D3 have been shown to increase performance values, and the last article really showed that vitamin D3 supplementation does not necessarily positively increase someone's performance by itself, but that training is the number one thing that affects if someone increases in muscular fitness or not, and that the supplementation is another side note or side piece for it. And so thank you all for listening.